Hello, I am Dana Lastman, otherwise known as Medicare Dana. I'm the owner of Jaybird Insurance Group, an independent Medicare brokerage. I help explain the Medicare program nationwide and all of your coverage options. I'm heavily focused in education. If you're 65, I know you are getting bombarded by phone calls and mailings and hearing things on the radio, even from friends and family, and it can be incredibly confusing. I like to say no one should do Medicare alone. And in this video, I'm going to review the Medicare program and all of your coverage options. My hope is that this helps you both feel a little bit more comfortable about what the program offers, as well as empower you to know that you've got accurate information under your belt. Lots of the phone calls and people calling you may be trying to persuade you one way or the other, and they may or may not be telling you accurate information. So once you have watched this video, I hope you feel like you are able to handle those calls a little bit better. If you have pen and paper at home, I would highly recommend taking it out. It's nice because this is a video, so you can push pause at any time, rewind, go back if you need to hear anything in additional time for clarity, but also jot down any questions that you have. Please get in touch with me. You can contact me via the website, medicaredana.com, using the contact sheet, or you can email me directly at dana@medicaredana.com. So we are going to go over what Medicare is and what all of your coverage options are. Medicare essentially is health insurance. It was enacted by Congress in 1965 under the Social Security Act for people who are 65 and older. There are some people under 65 with certain disabilities that may qualify for Medicare. Those are people with end-stage renal failure, permanent kidney failure requiring dialysis or kidney transplant, or anyone with ALS or Lou Gehrig's disease. Over 68 million Americans are on Medicare, with roughly 12,000 people turning 65 a day. Medicare is the widest, biggest health program in the United States. So very important to understand it. There's many people on it. Today, we're going to go through the different parts of Medicare, Medicare Part A, Medicare Part B, Part C, and Part D, as well as the optional supplement plan or Medigap plan. What is your Medicare coverage? There are two main ways that you can get Medicare. Original Medicare, which consists of Part A, Part B, and Part D, with an additional option for supplement plan, or Medicare Advantage, which is Part C, usually combining that Part A and B, and usually that Part D. These are two totally different programs that a lot of people get confused. You either have original Medicare with the supplement plan or a Medicare Advantage plan. Two totally different programs, different ways that you get your benefits, different costs. So they are very different programs, and it's really important to understand the differences between the two. With original Medicare, that's your A and B. You choose your doctors. You have no referrals. You choose the facility, the hospital. It's guaranteed renewable. This is a nationwide program that you have access to any doctor or facility that participates in Medicare. With the Advantage plans, they have a different structure. Those are going to be county to county usually. They're more of a referral based. You need referrals for specialists, prior authorizations. There are network restrictions. These are an HMO or PPO style plan with co-payments and deductibles. There's a potential for higher out-of-pocket costs with the Medicare Advantage plans. It's typically $0 or low dollar a month type of a program that you pay as you go. As you see specialists or as you have different treatments, you might have higher copays, and as you go along with the program, you're going to have to pay those. The doctors may leave the network, the hospital may leave the network, and the network or the plan might get canceled. These are not guaranteed renewable. They're not standardized. So each year they're renegotiated. Many times the contracting falls off, so that's why the doctor may leave. But this is going to be a more restricted, provider-specific network and policy. They do have lock-in periods. You are typically in an Advantage plan for the entire year before you can make a change. Then there's the prescription drug plan. The Part D prescription drug plan has 3 phases. The first is the deductible phase. In 2025, the highest a prescription drug plan deductible could be is $590. Not every plan goes up that high. Each plan has their own deductible. There's multiple plans out there that have contracts with Medicare, and each plan is going to have their own formulary, their own list of medications that they cover and how they cover them, as well as that's going to dictate the amount that they set for their deductible. But once you've met that deductible stage, you then enter your initial coverage. And in 2025, the max out of pocket you can pay for copays for medications is $2,000. Once you've reached $2,000, you've hit what's called the catastrophic phase, and you no longer have to pay any money for copays at the pharmacy. And then that plan will restart the next year. The monthly premiums for the plan vary based on the plan that you join. So as I said before, there's multiple insurance carriers out there that participate in Medicare Part D plans, the standalone plans. Each year the amount changes. It's really important that you review your drugs every year to make sure that both the plan's formulary stays the same and the cost of your premiums. With the Advantage plans, they bundle these, the prescription drug plan, so it's typically part of the entire plan, and the monthly cost wouldn't vary as much. So it's important to know the difference. I want to go over a couple definitions before we dive into some of the cost sharing. Coinsurance is splitting your healthcare costs with the plan on a percentage basis. So for example, you pay 20% and the plan pays 80%. That's a coinsurance. A copayment is a fixed amount that you pay, such as $30 for a service or product. Some people call this a copay. You might have copays to see a doctor. No matter when you go, you have to pay that flat fixed copay amount up front. And then there's a deductible. Deductible is a preset amount you have to pay first before Medicare or another insurance would start to pay. So let's look at Part A and Part B. This is considered original Medicare. And let's look at the costs of each. Part A is for most people $0 a month. This is because you've been paying into your FICA taxes. In order to be eligible for Medicare, you would have had to pay into these taxes for generally it's around 10 years or 40 quarters. Some people call this premium free. I don't love that word. You've been paying into it. It certainly hasn't been free, but there's not an additional cost each month for that Part A once you're eligible. Part A is for hospitals when you're admitted. So I think Part A admitted to kind of help you remember what it covers. And here on the screen, you'll see that red, white, and blue Medicare card. Your Part A will show as hospital with your effective date. Part A is going to cover inpatient hospital care, skilled nursing facility, hospice care, or home health care. Again, it's when you're admitted, and it typically covers room and board. So let me show you the breakdown of what you would be responsible for versus what the government pays when you're looking at Medicare Part A. There's a $1,676 deductible per each 60 days. Then after 60 days, there's a copay, $419 a day for day 61 to 90, $838 a day for 91 to 150, and after 150 days, you would be 100% responsible. On the skilled nursing side, the client, you would pay $0 for the first 20 days, and then you'd be responsible for a copayment of $209.50 a day. Everything circled here in yellow, these are the gaps in coverage for Part A of Medicare under Original Medicare. Now let's look at Part B. Part B does have a cost. There's a standard cost each month. It depends on income, and the amount can change each year. In 2025, that standard cost is $185. This is based on your income, and it's based on your IRS tax return. Social Security and Medicare does a 2-year look back. So they are looking at your filed IRS tax returns from 2 years prior. So in 2025, they're looking at 2023. If you file your taxes jointly, they're looking at $212,000 or less. Or if you file them individually, $106,000 or less. And that is based on your MAGI, your modified adjusted gross income. So if you make under than $106,000 or you filed on your IRS tax return under than $106,000 a year, then you would be paying the standard Part B premium of $185. And the same goes if you jointly file and you're under $212,000, you'd be paying that $185. If you are a higher wage earner and you've earned more than that, or at least that's what's indicated on your IRS tax return, you will get an additional charge called IRMA. It stands for Income Related Monthly Adjusted Amount. It's really important to know this. A lot of agents overlook it. Even when I work with wealth managers and CPAs, these are things that we look at because as you are planning for your future, you want to make sure if you're selling homes or moving funds and it puts you into a bracket that is higher than that standard, you might be having to give that money right back to the government. So knowing the IRMA tables and understanding how they are identified in terms of where you might have to pay more is really important for your planning purposes. Part B is going to be doctor and outpatient visits, basically anything outside of being admitted to the hospital. This is outpatient care, ambulance, emergency room, laboratory, durable medical equipment, outpatient, and some preventative care. And on your red, white, and blue card, you'll see that as medical Part B with a date that's effective. Let's talk about how that is broken out in terms of what you'd be responsible for cost and where the government would pay under original Medicare. There is a $257 annual deductible for Part B. If we look at a charge, let's say you get a bill for $11,500, and the Medicare approved amount is $10,000. Now, there are a couple ways that doctors can participate on Medicare. If a doctor accepts assignment, they're going to accept that pre-approved Medicare amount, bill that, and be on their way. A doctor can also accept Medicare or participate in Medicare, but not accept assignment. If a doctor does not accept assignment, they can charge you 15% above the Medicare approved amount. So there's also a third option. A doctor can just say, I don't take insurance. You got to pay me that cash. But right now we're going to look at the not accept assignment versus assignment for doctors that do participate on Medicare. So you get this bill, it's $10,000. For Part B, original Medicare, the government will pay 80% of that Part B. So with the $10,000 amount, they're going to pay $8,000. You are responsible for 20% of that. If you are seeing a doctor that does not accept assignment, who could charge 15% above, there's this excess charge, is what it's called, of $1,500. Here in yellow are all the gaps then that you may be responsible for if you're on original Medicare, the difference between where the government pays and what you would pay. So looking at both A and B, there are a significant amount of gaps. If you had just original Medicare, you would be paying a lot potentially out of pocket. We do not ever suggest someone only have original Medicare A and B because there's no cap on these expenses. This 20%, there's no cap. Lately, not many procedures and treatments are done where you get admitted. So many are, out of office, from knee replacement to mammogram to colonoscopy, even to a lot of heart procedures. You're in and out the same day. So that 20% can really put you out of pocket a lot of money. So what the government decided to do was come up with a supplement or a Medigap plan to cover some of those gaps. Now, Medigap and supplement can be used interchangeably. If you hear someone say supplement plan or Medigap, they're both the same. These are the secondary insurance you can purchase to go hand in hand with original Medicare and basically carry and catch those yellow gaps that we just reviewed. The supplement plan follows the exact same rules and guidelines as original Medicare. It's under the same program. So there are no referrals. You choose your doctor as long as they accept original Medicare. You choose the facility, you choose the hospital, and it's guaranteed renewable. And 96% of doctors and facilities accept original Medicare these days. So this is just your access to who you need to see and where. It also travels with you. The supplement plans are standardized and they go with you all through the United States. So if you travel anywhere you travel, you have that coverage, it comes with you. Here on this table are all of the standardized supplement policies. Standardization here is a big deal to understand. So if you have a G plan, for example, and you're in Texas, and you have friends or family in Illinois or Florida, Georgia, Maryland, wherever it may be, and you're all under that G plan, you have the exact same benefits and coverage. It's not the insurance company that dictated, it's part of this program. You may pay differently in your monthly costs because that does depend on the carrier and your zip code, as well as gender and tobacco use. But you have the same coverage and same benefits. If you look at the top here, you'll see that there are some letters that are missing. In 1965, when this was developed, there were a lot more options for supplement plans that covered benefits that are now no longer needed. For example, in 1965, when this started and over the course of the years as it's been, updated, at one point there was a supplement plan that offered prescription benefits. Well, now we have an entire Part D program, so that has been removed. Also, as of recently, C and F plans have been completely taken off the table for new business. Anyone who was born after January 1st, 1955, or who turned 65 after January 1st, 2020, is no longer eligible to purchase Plan C or Plan F. The idea of these plans, again, is to have a secondary option to purchase an insurance that will cover those gaps of original Medicare. And if you look here at A, Supplement Plan A only covers the basics, including 100% Part B insurance. So if we go to our little chart here, that would mean it covers these daily copays and that 20% coinsurance. If you had A only, you'd still have some costs that wouldn't be covered. On here, Plan B covers the same, but also has that Part A deductible. So when you look at this chart, you can see that the boxes that have the most filled are the plans that cover more of the gaps. And the F and G plan are going to be what have the most comprehensive coverage, but that F plan is no longer available. So G becomes the plan that is most comprehensive for you to purchase. The only thing you would pay is that Part B annual deductible. So with a supplement plan G, combined with your original Medicare Part A and B, all of these gaps are removed. They also have a foreign travel emergency benefit built in. There's a $250 deductible with a $50,000 lifetime maximum. And you would just be paying that $257 annual deductible. So when paired with the supplement plan, you are able to know what your out-of-pocket spend might be for the year. If you have a really difficult medical year, you will know that you're spending that $257 along with whatever your monthly premium is for the supplement plan, but your expenses are capped. There's no surprise costs if you get hospitalized. If you have a really healthy year, maybe you don't ever spend that $257, but you still know what you're spending. It would be that monthly cost for the supplement plan, and that's it. So it's a good way to know what, from a financial perspective, you might be paying for that year. A couple important pieces of information to be aware of. Veterans, retiree COBRA, or individual insurance are not replacements for Medicare. This can be really confusing. If you are on Veterans, retiree, or COBRA, or an individual plan and don't enroll in Medicare when you're supposed to enroll, your insurance carrier may deny your claim, saying that Medicare should be paying for it because you should be on Medicare. Under Original Medicare A and B, you cannot be turned down because of your medical history or pre-existing condition. So when you're in your initial enrollment, which initial enrollment for Medicare is 3 months before your 65th birthday, the month of your 65th birthday, and then the 3 months after. So it's a 7-month window. You cannot be turned down. Additionally, during the 6 months after your Part B effective date, you are in this initial enrollment period where you can get a supplement plan without any medical underwriting or acknowledgement of pre-existing conditions. This is really important because once you pass that 6-month period, there will be medical underwriting, and I'm going to talk about that here in the next slide. So we'll go a little bit deeper into that. If you're working past the age of 65 and on a group employer plan, you may have the option to delay Medicare without penalty. This, however, is very tricky. There are a lot of rules and there's nuances to how many employees are at your company and if you're contributing to an HSA. For this reason, I always suggest talking to a Medicare expert when you're approaching your 65th birthday so that you can be on the right path. So many people, your friends, your neighbors, your family will say you have to enroll or you'll be penalized. And that might have been true for them, but it might not be true for every circumstance. There are such rigid deadlines and timelines for Medicare. If you don't enroll when you're supposed to enroll, you can get what's called a late enrollment penalty. You can receive that from Medicare. And if you get a late enrollment penalty, you get a monetary charge that you have added to your monthly premiums for the life of your time on Medicare. It sounds dramatic, and it is. I don't create these programs, don't shoot the messenger, but it is important to know because you could have an additional charge added onto your premiums for life. So talk to an agent that specializes in Medicare. The other thing about that is talk to an independent agent. I'm really passionate about working with an independent agent because an independent agent is going to be writing with multiple carriers. They're going to be able to give you the full menu, for lack of a better word, of all of your options. If you work with a captive agent, that means that they're only working with one insurance carrier. So not only are they going to let you know if other carriers have better rates, but they're not going to have any flexibility. And as you work with these agents, you may have 1 year where you have some really high rate increases. And if you're healthy enough and can pass medical underwriting, that agent can get you on the exact same plan with a different carrier. But if you work with someone who only works with one carrier, you don't have that option. The other thing that is important to note is typically when you work with a Medicare agent, they're going to be your point person or should be your point person when you're on the Medicare tract for life or for as long as you are their client. Some people ask me, why should I work with an agent versus going straight to the carrier? If you go straight to a carrier, your monthly cost doesn't change. Agents, we get commission from the insurance carrier when you sign up. No one should be charging you consultative service fees because we get paid commissions when we sign you up. But you don't get any discount if you go straight to the carrier. Instead, you don't have a person that you built a relationship with. So you're going to have to call that 1-800 number, get rerouted to someone anytime you have a question. They're not going to know you, develop a relationship with you, and be able to quickly assist you. So I always urge people to work with somebody so that you have a contact when you get a bill you don't understand, when there's confusion about, doctors, whatever it might be, having a personal agent is critically important. Let's talk a little bit about medical underwriting. With the Advantage plans, there's no medical underwriting. You can join a Medicare Advantage plan with any type of health condition. With Medicare supplements and Medigap, there is medical underwriting. So as I said before, you've got 6 months from getting that Part B effective date to Enroll in any supplement plan without medical underwriting. After that, if you want to make a change, you have to undergo medical underwriting. This is so important because if anyone has any type of an ailment, particularly like a cancer, AFib, Parkinson's, these are things that are typically declinable. You need to make a really good decision on your first initial enrollment because you may never be able to make a change. If you went to Medicare Advantage and then, a few years down the line realized, oh, I want to go back to original Medicare, you have to pass medical underwriting and may not be able to pass it. After that 6 month period of when you are on a supplement plan and you want to make a change, you can change any day of the year with the Medigap or supplement, but you still have to pass medical underwriting. A lot of times there's confusion out there because people will hear you can change any day. You can, but you have to pass medical underwriting. Medicare Advantage has lock-in periods. So once you're in that plan, you are locked into it for the year. There's one time of year you can make a change. Where the supplement plans, there aren't lock-in periods, but like I said, if you want to make a change, you do need to go through that medical underwriting. It's all about mitigation of risk and understanding where those gaps might be and understanding why the gaps are there to begin with. And then for you personally, how your health is, what's going on in the moment, but also potentially down the road to understand these medical underwriting is really important. So you just know in the future, should something happen, you may or may not be able to make a change. There are gaps in plans. With Medicare Advantage, they do not cover cancer as well as the supplement and original Medicare and with a supplement policy. On the Medicare Advantage plans, you're responsible for 20% of any medication that you get in a facility. So dialysis, chemo, anytime that someone is giving you a medication outside of, like in a facility, but outside of a pharmacy, it's only covered at 80%, you're responsible for 20. So for like a chemo, that could be incredibly costly. And you might reach your deductible really quickly. And if you have a cancer treatment and you reach your deductible at the end of the year in December, and then January it starts over again, but you are still going in your treatment, you might be very quickly putting out a lot of money. So I always talk to people who have Advantage plans about a cancer policy. I do also talk with people who are enrolled in supplement plans about a cancer policy as well, because it's just additional. But you get cash in hand if you get diagnosed with cancer, and it could be anywhere from $5,000 to $100,000, depending on what you purchase. And especially for the Advantage plans, this can really help that 20%. Or people might get a cancer policy that reaches whatever their highest deductible is, so that if they have to spend that each year, they have it covered. The cancer policies will also cover, if you have to go out of state, it might cover, well, you decide what you want to use it for, but it could cover flights or parking at a hospital, or maybe you're now out of work due to the cancer, and it could help subsidize that a little bit. The other gap with the Medicare Advantage is hospital indemnity plans. When you're on the Advantage plans and you get hospitalized, there's a very large copay per day in the hospital. They're usually for 5 to 7 days. You have a pretty large copay. So purchasing a hospital indemnity plan will basically reimburse that for you. So those are two things that I typically guide clients through if they do want a Medicare Advantage plan, so that if you get into these situations, you've got some coverage there. With the Medicare supplement plans, they do not cover dental, vision, and hearing routinely. The Advantage plans will bundle and add some sort, even if it's minimal, some sort of dental, vision, and hearing usually. The original Medicare and supplement plans do not cover dental, vision, and hearing. I sell a standalone policy that many of my clients who have a supplement plan will purchase, but that routine visit isn't covered. However, glaucoma or cataracts are covered under original Medicare and within that supplement policy as they're medically necessary. Again, it's about mitigation of risk. Just knowing where some of the gaps are of coverage and how you can protect yourself best going into either one of these plans. It's a lot about who pays first when we talk about mitigation of risk. With Medicare Advantage, you've got a private insurance company that is now coordinating all of your benefits. And the reason I didn't go through example of a Medicare Advantage policy is they're all different. They're not standardized, but they all observe that HMO PPO type policy where there's copays and deductibles, but they have different benefits and they're all different and they're renegotiated every year. But they are actually a substitute for original Medicare. So the Medicare Advantage, if you're on that program, you're taken out of original Medicare. You're no longer underneath that government run program. And that private insurance company, whoever you're with, is now coordinating your benefits and managing your funds. The government gets or pays the insurance carrier per person to be off original Medicare and now onto the Advantage plan. And then that insurance carrier is the one who's now gatekeeping and managing the funds. It's a lot of the reason why there are prior authorizations, denials, and referrals needed within that program. With the Medicare supplement plans, the government is coordinating and managing the funds. So with the Advantage plan, what I didn't say is that if you're on an Advantage plan, your red, white, and blue card is no longer needed. You can put that in your safe. When you go to the doctor, you're handing over just one card, your Medicare Advantage card. For people on the supplement plan with original Medicare, the government is paying first. So that red, white, and blue card is what you're giving to your doctors and facilities, along with, because you're giving them two cards, your supplement card. So maybe that G card. Original Medicare pays first, the government pays first, and then your supplement policy is going to pay second. This is why medical underwriting is so important, because the government is not going to want to take people in that are really sick because they have to pay first. Mitigation of those risks. Really similar to car and auto insurance. You cannot get insurance once you get into a car accident. It's very similar here in terms of medical and just kind of understanding the dynamics between who pays, where the mitigation of risk is, and why medical underwriting is there. With the Advantage plans, the mitigation of risk a lot of time is on you as the consumer. If you're sick, you're going to be paying more, most likely out of pocket for your treatment. Someone who doesn't go to the doctors that much is not going to be paying so much. Also, a little difference in the structure of payments. The Advantage plans are going to have a low or zero monthly premium because it's like a la carte services. You pay as you go until you reach that deductible. The supplement plans are going to have a higher cost each month. It's a flat fixed rate that you pay whether you use it or not. So you're really paying on the front end versus the back end. I do always say no one should do Medicare alone. There are so many times I receive questions from people, whether it's a bill that they got, confusion, someone calling them. Medicare will not call you. There's a lot of scams that you guys are the target of. And anytime you have a question, my clients will send me pictures and email me letters they get to just make sure, is this accurate or not? I've built a really wonderful community that look out for each other. I try to look out for you as much as possible. And I do that on my blogs and videos. Lots of the blogs are about Medicare related things. Some are other just about senior services in the area, but a lot of Medicare related issues, as well as real-time updates on my Facebook, MedicareDana.com. The blogs and videos are on the website, MedicareDana.com. And then I have a YouTube with videos as well. It is so important to be education focused here because someone can call you and very quickly switch you into a plan if you don't realize what's happening. For example, if you get switched from a supplement plan to an Advantage plan, you might not be able to get back into it if you have health issues. So it's so important to be informed. It's so important to feel empowered in knowing what the information is. Many times doctors' offices and billing, they make mistakes. So we want to know and be clear about what the program does, what you're entitled to, and how it's supposed to be billed. I truly Truly love what I do. I spend a lot of time just making sure that all of you have accurate and clear information so that no one can take advantage of you. So please look through all of the library of videos and blogs. And if and when you're ready to get enrolled in Medicare, I am ready to help you. MedicareDana.com. Thanks so much.